Bismillahirrahmanirrahim. Quote for today is it's time to celebrate success, but it is more important to learn the lessons of failure. Today, the topic of my presentation is syphilis, and I'm presenting it under the supervision of my professor, Dr. Saira Afzal. Learning outcomes of the presentation are introduction, epidemiological triad, chains of transmission, clinical features, level of prevention, recent updates, and MCQs at the end. At the end of this presentation, participants will be able to describe about the syphilis, its epidemiological triad, stages, and levels of prevention. Now, what is syphilis? It is a sexually transmitted infection that can cause serious health problems without treatment. Infection develops in stages that is primary, secondary, latent, and tertiary. Each stage has different signs and symptoms. Syphilis increases the risk of both transmitting and getting infected with HIV. Now, the spread of syphilis. One can get syphilis by direct contact with the syphilis sore during vaginal, anal, or oral sex. Syphilis can spread from a mother with syphilis to her unborn baby. One cannot get syphilis through casual contact with objects such as toilet seats, doorknobs, swimming pools, and sharing clothes or eating utensils. Risks for syphilis are gay or bisexual men, HIV positive persons, those taking pre-exposure prophylaxis for HIV prevention, partners who have tested positive for syphilis, all pregnant people should receive syphilis testing at their first prenatal visit. Now, regarding the epidemiological triad, there are agent factors, host, and environmental factors. In the agent factors, there is Treponema pallidum. It is a spirochete bacterium with various subspecies that causes the disease syphilis, Beagle, and jaws. It is transmitted only amongst humans. Treponema pallidum is a small spirochete that measures about 6 to 15 to 0.2 micrometer. It has 6 to 12 coils, and there is no culture and may it survive in the blood. The only host, natural host that is seen for Treponema pallidum is human. Transmission of the parasitic infection, it is transmitted from person to person by direct contact with the syphilitic sore that is known as chancre. Incubation period, the average time between acquisition of the syphilis and the start of the first symptom is 21 days, but it can range from 10 to 90 days. Signs and symptoms of syphilis. There are 4 stages of syphilis: primary, secondary, latent, and tertiary. Each stage has different signs and symptoms. Primary stage, the chancre. During the first primary stage of syphilis, one may notice a single sore or multiple sores. The sore is the location sorry, where syphilis entered in the body. These sores usually occur in or around the penile area, vagina, anus, rectum, lips, or in the mouth. And sores are usually, but not always, firm, round, and painless. Secondary stage, it is seen in 6 weeks to 6 months after primary chancre. It is usually diffuse, non-pruritic, indurated rash, including palms and soles that may look rough, red, or reddish brown. Other symptoms may include fever, swollen lymph node glands, sore throat, patchy hair loss, headache, weight loss, muscle aches, and fatigue. The symptoms from this stage will go away with treatment. Without treatment, infection will move to the latent and possibly tertiary stage of syphilis will come. Latent stage of syphilis is a period when there are no visible signs or symptoms, and without treatment, one can continue to have syphilis in body for years. In tertiary stage, most people with untreated syphilis do not develop tertiary syphilis. However, when it does happen, it can affect many different organ systems. These include the heart, blood vessels, brain, and nervous system. Tertiary syphilis is very serious and would occur 10 to 30 years after infection begins. In tertiary syphilis, the disease damages the internal organs and it can also result in death. A healthcare provider can usually diagnose tertiary syphilis with the help of multiple tests. Now, what is neurosyphilis, ocular, and otosyphilis? Without treatment, syphilis can spread to the brain and nervous system that leads to neurosyphilis. When it spreads to eye, this is ocular syphilis. When to the ear, it is otosyphilis. This can happen during any of the stages that is described above. Late benign syphilis or the gumma presentation. The gumma is the most common complication of late syphilis. Gummas may be single or multiple, start as a superficial nodule or as a deeper lesion that breaks down to form punched out ulcers. They are ordinarily indolent, slowly progressive, and indurated granulomata, with central healing with atrophic scar surrounded by hyperpigmented borders. May be destructive but responds rapidly to treatment, thus, it is relatively benign. This is the picture that is shown of the gumma lesions. This slide shows the stages of syphilis that I have already told the details and with the pictures. Now, congenital syphilis. Congenital syphilis is transmitted in utero after the first 16 weeks of pregnancy. Therefore, it is usually not a cause of abortion during the first trimester. It has been divided according to the arbitrary dividing line of 2 years into early and late types. Early congenital, the features are similar to secondary syphilis. Usually, it occurs 2 to 8 weeks after birth, presenting with a failure to thrive, mucocutaneous lesions, um, generalized lymphadenopathy, and nasal snuffles and skin rash. Late congenital is the onset usually occurs at or near puberty. Well-known stigmata includes nerve deafness, interstitial keratitis, Hutchinson's teeth, Clutton's joints, osteotitis, chondritis, that is saddle nose, frontal bossing, severed tibia, and perforated palate. Hutchinson's teeth, the upper central incisors are widely spread, centrally notched and tapered in the manner of screwdrivers. The molars may show multiple poorly developed cusps, that is, mulberry molars. This picture shows the baby that is born with the secondary syphilis. Congenital syphilis can cause miscarriage, that is, losing the baby during pregnancy, stillbirth, a baby born dead, prematurity, low birth weight, or death shortly after birth. Up to 40% of the babies born to women with untreated syphilis may be stillborn or die from the infection as a newborn. Now, the levels of prevention, three basic levels, primary, secondary, and tertiary levels are being discussed. Specific protection, syphilis is unique among sexually transmitted diseases in that it remains curable with a single dose of penicillin with no documented risk of resistance. Formulated for this purpose is a long-acting benzathine penicillin G. No vaccines are there to prevent syphilis. Regarding secondary prevention, there is early diagnosis and prompt treatment. For early diagnosis, syphilis serological assays are used. That is, venereal disease research lab, rapid plasma regene, automated regene test. Treponema specific assays are fluorescent treponemal antibody absorbent assays, microhemagglutination antibody testing, and automated treponema palladium enzyme immunoassay. This picture shows the standard protocol for syphilis screening and diagnosis. Regarding treatment, two domains that are available for syphilis and for congenital syphilis. For primary, secondary, early latent syphilis, recommended regime is benzathine penicillin G, 2.4 million units intramuscular. And those having penicillin allergy are given doxycycline 100 mg twice, ceftriaxone or azithromycin 2 grams. And for congenital syphilis, proven that is highly probable disease, aqueous crystalline penicillin G, 100,000 to 150,000 units per kg per day. Administered as 50,000 units per kg per dose IV, 12 hours during the first 7 days and thereafter 8 hours for 10 days. This shows the summary of the disease. Now coming towards the recent updates. WHO has recently published sexually transmitted infections in 2006 to 21 that shows the Global Health Sector Strategy on Sexually Transmitted Infections 2016 to 21, built on the conclusions from the evaluation of the implementation of the Global Strategy for the Prevention and Control of Sexually Transmitted Infections, and sets out a vision, goal, target, guiding principles, and priority actions for ending the sexually transmitted infection epidemic as a public health problem. This page article shows the global elimination of congenital syphilis, rationale and strategy for action. This shows the overarching global goal of the present strategy is the elimination of congenital syphilis as a public health problem. This would be achieved through reduction of prevalence of syphilis in a pregnant woman and by the prevention of mother-to-child transmission of syphilis. The strategy rests on 4 pillars. One, it ensures sustained political commitment and advocacy. Second, increases access to and quality of maternal newborn health services. Third, screen and treat pregnant women and their partners. And fourth is to establish surveillance, monitoring, and evaluation system. Then WHO gives the triple elimination initiatives. New data suggests STDs continue to increase during the first year of COVID-19 pandemic. That shows the newly released 2020 STD surveillance report found that at the end of 2020, reported cases of gonorrhea and primary secondary syphilis were up to 10% and 7% respectively, that were compared to 2019. Syphilis among newborns, that is congenital syphilis, also is increased, with reported cases up nearly 15% from 2019 and to 35% from 2016. Early data indicates primary and secondary syphilis and congenital cases continued to increase in 2021 as well. Reported cases of sexually transmitted diseases in the United States decreased during the early months of COVID-19 pandemic in 2020, but most resurged by the end of the year. Ultimately, reported cases of gonorrhea, syphilis, and congenital syphilis surpassed 2019 levels. Several factors likely contributed to the initial decline in the reported STD cases during the first part of 2020. That includes reduced frequency of in-person healthcare services as routine visits decreased, resulting in less frequent STD screening. STD test and laboratory supply shortages and telemedicine practices has led to some infections that are not being captured in national data. Now, syphilis statistics. Most men account for the most cases of syphilis, with the vast majority of those cases occurring among gays, bisexual, and other men who have sex with the men. This graph shows primary and secondary syphilis distribution of the cases by sex and sex of the partners in the United States 2020, and this can be seen that it's a constantly increasing trend, and it's most common in those people that have sexual contact, that men and men have sexual contacts. Now this shows syphilis patients surging in Japan in 2022. In Tokyo, cases of syphilis are surging across Japan, with the number of patients so far this year up to about 1.6 times compared to the same period in 2021. a year that saw record high case figures, prompting medical specialists to it has become a common STD. The infection rate when a person has sex with a syphilis patient is high at around 30%. However, it is thought that patient tends to be unaware they're infected and fail to take tests or undergo treatment, which in turn accelerates the spread of infection. Now, this shows congenital syphilis increase in the US. The rising congenital syphilis number in the USA reflects the reality of the nation's syphilis epidemic and the growing trend of syphilis infection among women and their male sex partners. Syphilis is not only sexually transmitted disease that is increasing in USA. According to CDC, there were nearly 30% increase in chlamydia, gonorrhea, and syphilis between 2015 and 19, with the sharpest increase in the case of congenital syphilis, which nearly quadrupled during that time period. Syphilis in the newborn is on the rise in US, and this is the statistical figure shown. National AIDS Control Program is also shown. This tests the heterogeneity and interlinking of high-risk injecting and sexual behavior, combined with the low level of HIV knowledge and prevention, and high levels of other STIs. A few of the main objectives of the National AIDS Control Program are as under: prevention of HIV transmission, safe blood transfusion, reduction of sexually transmitted disease transmission, and establishment of surveillance. Now coming towards the multiple choice questions. First MCQ is: syphilis is a sexually transmitted disease that can cause serious health problems and is caused by the spirochete. The disease is option A bacterial, fungal, option B bacterial, option C viral, option D parasitic, and option E prionic infection. Anyone?
A, bacterial. B.
Yes, B is the right answer. This is the bacterial infection. Second MCQ is: Shankar is a painless ulcer that is most commonly formed during the primary stage of syphilis and is found in the option A throat, chest area, and vagina. Option B genitals only. Option C is buttocks, back, arm, and legs. Option D genitals, anus, rectum, lips, and in the mouth. And option E anus and rectum.
D.
B.
B. Option D is the right one. This is found in all the stages. Third MCQ is: syphilis has 4 stages. In which of the following state of the antibody test it is found to be positive in the 1 to 3 weeks post the appearance of Shankar? Option A tertiary syphilis stage, option B secondary syphilis stage, option C primary syphilis stage, option D latent syphilis stage, and option E primordial syphilis stage.
D.
Option C is the right one. Primary syphilis stage, because it's positive in 1 to 3 weeks in this stage. Fourth MCQ is: congenital syphilis is transmitted in utero after the first 16 weeks of pregnancy. Which of the following stage of syphilis is asymptomatic and not contagious? Option A primary, option B secondary, option D C latent, option D tertiary, and option E quaternary stage.
C, latent.
Yes, option C is the right one. Latent stage is asymptomatic. Fifth MCQ is: guma in syphilis may be single or multiple. Start as a superficial nodule or a deeper lesion. In addition to rashes, oral lesion of the secondary syphilis includes all except option A snail track ulcer, option B mucus patches, option C Shankar of tongue, option D Hutchinson Zwart, and option D Shankar of rectum.
E.
E.
D. Option C is the right one. Sixth MCQ is: Generalized skin rash symmetrically distributed on flexor aspect of the arms, flanks, and palms. Painless, indurated, and pleomorphic in nature. Accompanied by lymphadenopathy is a characteristic of which of the following disease? Option A measles, option B rubella, option C chickenpox, option D smallpox, and option E secondary syphilis.
E.
E.
Yes, option E is the right one. Secondary syphilis has all these characteristics. Seventh MCQ is congenital syphilis is a chronic infectious disease that is acquired by the fetus before birth. Which of the following is not the common characteristic of the congenital syphilis? Option A, Gone complex. Option B, interstitial keratitis. Option C, Melbury molars. Option D, notched incisors. Option A, Shankara of the tongue.
A.
Yes, A is the right answer. Eighth MCQ is neurosyphilis is a bacterial infection of the brain and spinal cord. It usually occurs in people who had untreated syphilis for many years. General paralysis in neurosyphilis is a feature of option A is the primary stage of syphilis, option B latent phase of syphilis, option C secondary stage of syphilis, option D tertiary stage of syphilis, and option E primordial stage of syphilis. Option D is the right one, tertiary stage of syphilis.